Okay, so I'm Melissa Shear. I'm the director of the Travis County Mental Health Public Defender, and I brought just a few slides to explain what we do and how we do it. We've been here for 10 years now. So the first one is our organization chart. We are a very small office. We have myself as director. On our legal team, we have 2 full-time attorneys, and we actually have a special project attorney that's coming on for 1 year. We got funding for this coming fiscal year for that lawyer to focus on people with intellectual disabilities and focus on working with those populations, working with the service providers, and creating some best practices that we can use going forward. And then they'll also train the other lawyers that are on the mental health list of attorneys that take these cases, because a lot of folks have an intellectual or developmental disability that varies different. It's much different than just dealing with a single mental health diagnosis. So we will have 3 full-time lawyers this year. Since I'm the director, then I only have a smaller caseload. I take about 50 cases per year. The full-time attorneys take about 200 cases per year. So in addition to the legal team, we have an administrative team of 2. We have an office specialist and we have an administrative associate. And our office specialist, she answers the phone, she greets clients, she sets up the files, opens cases, communicates with the court about setting cases, transporting defendants to court or not. She also does some talking with clients, like if there's someone that calls and needs a court date or needs to know what their court date is, she'll get that information for them. And then our administrative associate is in charge of our defender data. So we've got defender data. That's how we track all of our stats on all of our cases, and she is in charge of making sure that all of that data that's in there is accurate, so that we can report and turn those numbers over to people that know how to work with those numbers, statisticians, and come up with some good reports to figure out if what we're doing is working or not. That's one of the really big things that we've focused on the whole time that we've been here, is that we want to be sure that we're not just doing something to be doing it. We want to be sure that what we're doing is actually benefiting these clients in this population. So probably the most important piece of our office is our social work team. So that's why there's the most of them. We've got a case management coordinator who's a master's level social worker. We've got 1 social work position, and then we've got 4 caseworker positions. Okay. Our client population is adults 17 and up. Generally, our clients have been arrested lots of times. They usually have a serious diagnosis of mental illness, and in addition, we also take the clients that have the least resources and the most significant mental health problems. So because our office can only take about 400 cases per year, and the other ones are given out to the capillary private defender, we take the ones that have the most serious needs, since we do have the social work staff to spend more time with them. For legal cases, we only do Class A and B misdemeanors. We're hopeful that one day we'll get enough funding to hire more lawyers so that we can do more than that. But our social workers will take social referrals that are misdemeanors or felonies. So people that are on the mental health list that are not attorneys from our office can call up our social workers and say, can you help me with this client? And they can do that. All right, so one of the main ways that we work is that we have client teams. Every client that gets appointed to our office has a lawyer and a caseworker assigned from the very beginning. And so we try to work together as far as going out to visit the client together, um, making an assessment together, trying to decide what's important, what we're going to work on. We can't always go out together to see them, so we do schedule times to talk to each other frequently. So we have full staffings with our entire team on Mondays and Wednesdays of all of the cases that are going to be on the docket for that next day. And at that time, we also can staff issues that we've had with other clients that we can work out solutions together. So what we have is that the lawyer and the social worker are they're going to be talking to each other about the charges, the collateral consequences that there might be, the client's legal history, social history, what kind of needs they have and what kind of goals they have. Because there are some clients that will tell a social worker some things that they won't tell the lawyer. And so the lawyer might think, okay, it's, this is all set, we're going to do this plea and everything will be okay. But then maybe they've told the social worker, well, no, I'm going to get kicked out of my housing if I have a conviction for this. So we do a lot of talking about what every scenario would be for our client, socially and legally, so that we can come up with the best option for them. And that also sort of includes, like, sometimes people will get offered probation, and most of our clients are not capable of being on probation. The requirements for probation would be really hard for me to do. And so if you add a whole bunch of mental health issues and no income, no support, getting around to all of those appointments and jumping through all of those hoops is really difficult. So by having the staffing of all of us together, we can talk and say, is probation really an appropriate thing for this person? And if it is, what conditions do you think that this person could handle? So we're able to use all of our brains together and try and figure out something that works. And generally, when we talk, we have a mental health prosecutor, and generally when we will come to the prosecutor, if we've got a plan, then he will frequently go with our plan. So if our plan is, if you dismiss it, then we've got this person going over to this place and they're going to do this and this and this, then he's more likely to follow through with that recommendation, because it takes care of his need and ours. So I've only got 5 minutes, so I'm going to speed through now. All right, so one of the things that's different about our office than a local mental health authority is that we do what we call intensive community case management. And there's 3 phases that are constantly ongoing, and we are building the relationship, dealing with their current needs, and maintaining the relationship. And so what's different about our office is even after the legal case is closed, as long as the client still wants to work with the caseworker, they can, as long as they have goals that they're still working on. And that's also important because, as we just talked about, there's a lot of recidivism, and so we have clients that come back over and over again, and so they have developed a relationship with the lawyer and a caseworker and see those same folks again. And they're like, can say, okay, we started on your SSI application last time, we'll do this time, keep things going. So next, some of the important things about the relationship is to meet the client where they are, develop a relationship with the client and with other service providers so that they can be moved on to other service providers, so that there's other support for them than just us. And also think outside the box and continue to have maintenance appointments with clients. And that might just be going to see someone and saying, hey, how you doing? I brought you a soda. You want a soda? We're at the Arch, which is the homeless shelter. Brought you a soda. All right. So like I talked about before, we continuously evaluate our program. And so I have just a few slides from the most recent evaluation that we have. which was presented to Commissioners Court a year ago. And so from that evaluation, you can see on this table, it shows the different types of assistance that our social workers provide in the intensive case management. So they provide stuff like basic needs, that's like if food stamp applications, clothes, we have clothes, hygiene kits, different stuff, any kind of basic needs that a person has. Benefits, financial, helping them apply for benefits. Employment and education, helping them get jobs or get into school or stuff that they need for that. Housing, ID assistance. A lot of people don't have identification and need that. So we do a lot of medical assisting as far as taking them to appointments and sitting with them. Like some people don't have someone to go to a colonoscopy with them. Our caseworkers will do that. So because the whole health of a person is what keeps them out of jail in the future. All right, so the last couple of slides are process measures. Is that the last research has shown that the clients that come to our office, their days to disposition are 40 days less on average than the ones that don't come to our office, than the ones that have a lawyer without the social services. And then for disposition outcomes, MHPD clients are 45% get a dismissal, whereas non-MHPD clients is 19% is the rate of dismissals. And then one last one on the recidivism rates. Our clients, all of them, I mean, most people will get arrested again, but ours get arrested less times than the ones that did not have the additional social services help. So as the lowest, so last year it was 50% recidivism rate for the assigned counsel and then 39% for us. And that's just because they do have those additional relationships with the caseworkers to help with the things that were causing them to get arrested. So, thank you.